Summer turns to fall. Arizona will likely be dealing with not one, but two respiratory viruses. Both of them can be deadly. This week, Governor Ducey is issuing new requirements for hospitals to report flu cases. It's all to help understand what's happening inside our healthcare systems, as they could become overwhelmed from flu and COVID cases at the same time. Taking a look at the numbers side by side for the 2019-2020 flu season, more than 36,000 influenza cases were reported to the state. So far this year, there were nearly 6 times as many COVID-19 cases at more than 206,000. ABC 15's Nicole Grigg explains the new numbers hospitals have to give.
Last week, Governor Doug Ducey standing side by side medical professionals, urging Arizonans to get the flu shot.
Flu season is just around the corner, and Arizona isn't taking any chances.
The governor signing a new executive order this week to track flu numbers. Hospitals will now have to report influenza cases, including the following numbers: positive or suspected cases inside the hospitals, ventilators in use, ICU beds in use by influenza patients or suspected patients, and the number seen inside the ER each day.
Yes, it's good information to have. You're right, it is extra reporting requirements.
Dr. Michael White with Valleywise Health says they are still seeing COVID-19 patients daily.
COVID-19 disease has not been, totally eradicated from our environment. There are patients every day that we see within the health system that continue to have COVID-19 disease. Many of them we're able to treat as an ambulatory, but we still have patients today that are in the hospital and in the ICU that have COVID-19 disease.
Health officials saying we could see our hospitals overwhelmed in the fall. So we asked Dr. White, what are they doing to prepare if they need extra beds or even space?
I think all of the plans and all of the things that we did to treat those patients that had COVID-19 disease still are in place from that, and would be ultimately the same type of things that we would use to treat those patients that were coming in with the flu. So all of that infrastructure within Valleywise Health exists. We're not taking any of that away.
And although the state has pushed for people to get their flu shot, it's unclear how many have been administered or if the state is tracking that data. However, the state will update this flu data dashboard with the new reporting requirements, but the data will not start until at least next week. Valleywise tells me that they have not heard of any shortages or supply chain issues with the influenza shot, but if you've reached out to your provider and you haven't been able to get the flu shot yet, they tell me that a lot of providers wait until October to start giving the flu shot, so be sure to check back. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.